My first experience was when I was 18. I went into depression, and so I've been actually fighting depression all these years.
It's pretty well understood that patients that have depression actually have biological changes in their brain in terms of the rhythms that you can detect on an EEG. Once you start stimulating them with this kind of treatment, which stimulates the brain with a certain frequency of stimulus, which is about 10 times per second, it actually alters some of the normal rhythms in the brain, or the pathological rhythms associated with depression. And so our research project is to measure those changes as it occurs during the time that a patient is getting better.
After many, many years of trying all kinds of medicines for depression, I was just going down. I just continued to go down no matter what medicine I was on.
The treatment applies a magnetic stimulus focally to the brain and then subsequently starts a stimulation that over a period of time seems to improve symptoms of depression. While depression is very common, probably about 25% of the population in the United States experiences some form of depression during their lifetime.
I got set up with Dr. Bennett as the physician coordinating the TMS, and it's just been a gift, just a real gift.
I think that TMS is the beginning of our understanding that the brain is based in electrical activity. Therefore, pathologies of the brain, such as depression, obsessive-compulsive disorder, schizophrenia, are based in abnormal electrical function of the circuitry of the brain. Taking this perspective, I think, allows us to look ahead and start to really study treatments that are more effective for treating different kinds of disorders and expanding our horizons as far as the types of treatments that we can bring to bear. So I think it's the beginning of a pathway towards successfully treating patients that we previously weren't able to treat.
And I came here 5 days a week for 6 weeks. And the drive is about 100 miles one way. The first 2 weeks my husband brought me, and then friends brought me, and then the last week I came by myself. I was so good.
Response has been overall very good. I think patients generally feel very, very few side effects. We have some slight scalp irritation. We have some slight headaches that are involved in this treatment. By and large, patients find that their depressions lift by the end of their treatment period. They're able to go back to work and then return to the care of their regular doctor.
It's my life back. It's my life back, really. It just changed me from darkness to light. It just brought life back to me.
We've been innovators in bringing this to the Sangamon County area, as well as developing the clinic and the alternative treatments that we can also provide to be sure that this is a continuation of good care for treatment-resistant depression.